When you've got accommodative esotropia, what's happening is that you are muscling your eyes as a way to focus. Now, when you start doing physical eye therapy, one of the things you learn is engaging the peripheral vision more. And if you start engaging the peripheral vision, let's say it's the right eye that's going in, and you start engaging the peripheral, you're going to notice that that right eye is going to start to move out. It's a reflection of relaxation. So that would be number one. You could certainly contact our office and we could see if we could help you. Number two, I would consider if you could find a craniosacral therapist. You know, as a craniotherapist, I find that cranial work sometimes can be very effective at interrupting the strabismus, the esotropia, because there's more movement and fluidity in and around the eyes, the head, and so on. And it sets up a foundation where the two eyes work together. Now, because this happened so long ago, there's probably a developmental arc of exercises that I would recommend that would include doing some things that would repattern those early motor patterns. Even though she's, as you say, 9 years old, if you find a developmental optometrist that can test her, I would be willing to bet that there's some unintegrated, very early motor patterns, I'm talking gross motor, that are unintegrated, that are influencing the eyes to continue to cross. These are called primitive survival reflexes. These are movement patterns that occur in utero. One of the purposes of the primitive reflexes is to help newborns adjust to being out of the womb. If the reflexes aren't completely integrated, they do affect our visual development, among many other things. This also can affect the infant's ability to explore creeping and crawling and, doing the normal motor activities like hopping and galloping and skipping and jump rope. These are all very important gross motor bilateral integration activities. And if these are inhibited, if they are impeded, then we start to see the kinds of things that you're reporting. So doing some kind of physical eye therapy that's developmentally based, not just eyeball based, but developmentally based, is going to be the best way to help your daughter learn how to use her eyes in a better way.